patient with dysphagia, difficult to swallow. So any volunteer, and this is the script. Okay, anyone, you are four, we bring four history to you.
Okay, doctor.
Okay, you can start. So 65 years old man, chronic smoker, complain of vomiting blood yesterday. He admitted in surgical ward. Take a history, focus history, examiner ask you some question.
Okay. Hello, doctor. Hello.
Yes, hello. Okay.
I'm Dr. Hamza, one of the surgical doctor. May I confirm your name and age, please?
I am Mr. John. I am 65 years old.
Nice to meet you, Mr. John. Today I have been to ask you a few questions regarding your condition. Is that okay with you, Mr. John?
Yes, can.
How can I help you today?
No, yesterday I have vomiting of blood and I asked the ambulance and I came to the hospital.
Yeah, really sorry, Mr. John, to hear that. Mr. John, your difficulties swallowing is related to solid or liquid or both?
It is related to solid, not liquid.
Okay. How did it start, Mr. John? Suddenly or gradually?
The dysphagia, you mean difficult to swallow. It is gradually.
Yeah. When did it start exactly?
Maybe 2 months ago.
Okay. Mr. John, is that worsening all the time or comes and go?
No, it is worsening all the time.
Okay. Does anything make it better?
No. If I take
Any,
water with solid fluid, can be better to swallow.
okay. Anything make it worse, Mr. John?
No, nothing.
Okay. Mr. John, do you have the ability to swallow your saliva?
Yes, I can.
Okay. When was your last meal, Mr. John?
It is yesterday. I just take my lunch, my dinner. After that, I have these vomiting of blood.
Yeah, really sorry to hear this, Mr. John. Mr. John, is there any unintentional weight loss in the
Yes,
last?
I lost 5 kilo in the last month.
Yeah. Do you have any changes in your appetite?
No,
Okay. Any fever?
no fever.
Okay. Is there any acid test or food regurg in your back of throat?
Yes, I have reflux for the last 5 years.
Okay. Mr. John, do you have bad smelling in the back of your mouth?
No,
Do you have any gargling sound when you swallow swallow water?
no,
Okay. Mr. John, do you have any pain when you swallow?
no.
Okay. Mr. John, is there any other medical problems you have,
Apart
like
from
hypertension?
reflux, like what? Like hypertension, diabetes? No,
Hypertension, diabetes, yeah.
no,
Any episode like this before?
no,
Okay, Mr. John, is there any surgical operations?
no.
Okay. Mr. John, is there anyone in your family had similar problem?
No, but my father died from a heart attack.
Really sorry to hear this, Mr. John. Please accept my sincere condolences.
Okay,
Mr. John, may I ask you some personal question?
okay.
Do you smoke, Mr. John?
Yeah, I smoked in cigarette for the last 40 years.
Okay. Mr. John, do you drink alcohol?
Yes, I drink alcohol every day, one can of alcoholic beer.
Okay. Mr. John, who do you live with?
I live with my wife.
Okay. Mr. John, where are you living?
No, I living in the city center.
Okay, Mr. John, do you take any drugs?
Medication for medical condition? No.
Okay, any allergy, Mr. John?
Allergy to what?
Any drugs?
Allergy to medication or food? Yes, I am allergic to seafood.
Yeah. Okay, Mr. John, is there any shortness of breath or
No.
chest pain?
No.
Any problems with water work or bowel work?
What you mean by water work?
Any changes in the frequency to go to the loo to pass urine or something?
You mean
pain?
change in the urine color or increased frequency or
Yeah.
pain during the micturition? I don't have
Okay.
any of this.
Okay. Mr. John, is there any cough, any
No.
chest pain? Okay. Any muscle pain, joint pain, Mr. John?
No.
Thank you, Mr. John. I will discuss
Alright.
with my
Okay.
doctor.
All right, Dr. Hamza, by the way, you read the scenario. What is written is this vomiting of blood. Okay? So it is better to start by what is amount and it is mixed with food or not mixed with food. So you need to start in this way. Like you have vomiting of blood. What is the amount? Is half cup mixed with food. After that, you ask about dysphagia. When you ask about dysphagia, it's okay. But I said to you, I have reflux since 5 years ago. What you expected this patient, he take a medication for reflux or not?
I think you take, but
You don't ask him. You don't ask him. I start from the end. What is your diagnosis?
I think esophageal cancer.
Cancer esophagus. Okay. So if it is a cancer esophagus, what is the cause of that?
Chronic GERD.
GERD or Barrett
irritation.
esophagus. So this patient have reflux and he don't take a treatment. So they have a reflux for 5 years. The doctor give him a treatment, he don't take a treatment. The doctor advise him to stop smoking or alcohol, he don't do that. So they have reflux complicated by Barrett esophagus. Barrett esophagus complicated by adenocarcinoma of the esophagus. So you ask about difficult to swallow to solid, not to fluid, and how to increase, how decrease, but you don't ask important question. What you expect is the level of difficult to swallow or the level of dysphagia. It is an upper, middle, lower.
I think lower.
Lower. So it is important when you ask, I back again to show you. So it is important to ask amount of blood mixed with food or not, dysphagia, level of dysphagia or level of food stock. Very important question. Loss of weight, loss of appetite. After that, you ask about everything. When you ask about urine, you need to ask in 3 items apart from prostate and all this. Just frequency of urine, color of urine, pain during micturition or during urination. The word is water work and all this, although it is slang, but usually the actors, it is highly educated. So we don't use the slang English with the patient. It is not like a layman. It is a layman. The actor is not layman. The lay examiner can be layman, like ordinary person, but the actor usually is highly educated. Even in Egypt, they can be from AUC or American University or British Council or something like that. You ask a question about where you live, which place, what is the importance of that?
I think related to social, not related to the case. Related to systematic.
No, it is not important where he live. You can ask sometimes in orthopedic, you ask the patient if you are living 1 story or 2 level or the bathroom is down or upstairs. This is important in orthopedic, but in this case is not so important. Okay. So what's your diagnosis? You mentioned cancer esophagus. Which type of cancer esophagus? Adenocarcinoma. And where is the level?
Where is the level? Lower third.
Lower third. And what is the cause of that?
Chronic GERD.
Gastroesophageal reflux or reflux. And what investigation you will do apart from lab investigation?
Lab investigations.
Apart from lab investigation, apart from يعني another is lab investigation.
Okay, endoscopic luminal biopsy.
Endoscope and take biopsy. Okay. All right. That's good. Okay. So we ask you again in the same scenario, but with little change. But you need to ask about amount of blood. Okay. Or you can ask. Okay, we can ask you. All right. So we have the same scenario again, but I make little change in the answer. So still I am 65 years old, chronic smoker, complain of vomiting of blood, and admitted to surgical ward yesterday. So you can start.
Okay. Hello, doctor.
Okay.
I'm Dr. Hamza, one of the surgical doctor. May I confirm your name and date?
Yes, I am Mr. John. I'm 65 years old.
Okay, nice to meet you, Mr. John. Today I have been to ask you a few questions regarding your condition. Would that okay with you,
you can ask. Yes, you can
How
ask.
can I help you today, Mr. John?
Yesterday, I have vomiting of blood. I called the ambulance and admitted to the hospital.
Really sorry to hear this, Mr. John. Mr. John, what about the amount of vomiting?
It is half of a cup is only blood, not mixed with food. Just blood.
Okay, Mr. John, is your vomiting occur suddenly or gradually?
No, it is suddenly and occur once. It is just blood, not mixed with food.
Okay, Mr. John, when exactly?
It is in the evening, 9 o'clock, and I called the ambulance. I came to the hospital.
Okay, Mr. John, it is worsen or comes and go?
No, it is occur once. So I came to the hospital and they put a cannula and give me fluid.
Okay. Mr. John, do you feel anything make this episode better?
No. It is occur once, so I don't know what happened.
Yeah. Okay, Mr. John. Mr. John, when was your last meal?
Exactly? It is in the evening yesterday, just 3 hours before vomiting of blood. Okay,
Mr. John, do you have the ability now for swallowing your saliva?
Yes, I have.
Okay, Mr. John, is there any unintentional weight loss recently?
No, but no.
Okay, Mr. John, is there changes with your appetite recently?
No.
Okay, any fever, Mr. John?
No fever. You don't ask about dysphagia. Difficult to swallow because the cause of bleeding is from esophagus. So it is essential to ask about function of esophagus, which is swallowing. Okay, you can ask. Okay,
Mr. John, is your swallowing related to solid or liquid?
No, I don't have any difficult to swallow. I don't have.
Okay. Mr. John, do you have any acid test in your throat?
No.
Okay, Mr. John, do you experience any pain when you are vomiting?
No.
Okay, Mr. John, is there any recent medical history?
Like what?
Peptic ulcer. You diagnose?
You mean that reflux or something? No.
Okay. Mr. John, is there any surgical procedure recently?
Not recent, but 30 years ago, I have a motorcycle accident. I have fractured femur. I came to this hospital and did operation, gave me blood. 2 weeks after surgery, I have jaundice.
Okay, really sorry to hear this, Mr. John. Mr. John, what about your family history? Is there anyone in your family had similar problem
Dr.
like
Hamza, when the patient tell you something like reflux or this patient has jaundice, you need to ask, you take a treatment, what happened, you have complication. You don't just take the knowledge. A patient
analysis
say,
for
I have jaundice. So just ask
okay,
him, what is the treatment? You take a treatment, is any complication, something like that. Okay?
okay,
All
okay.
right. You can start.
What about the do you take any medications for the jaundice?
Yeah, actually, the doctor say it is hepatitis, and 30 years ago, they don't have a treatment for hepatitis or vaccine. So when I heard recently that they have treatment in the year 2000, I went to the hospital and they tell me that is already the virus is affect my liver, and we just
Okay,
can give
really,
you some liver support.
okay,
Okay.
really sorry. Mr. John, anyone in your family had similar problem?
No, my father died from heart attack.
Really sorry to hear this, Mr.
Okay,
John.
thank you.
Mr. John, is there, do you take any medication?
No, I don't take any medication, but sometimes the doctor give me some vitamins and all this, but no real medication.
Okay, don't have any allergy, Mr. John.
I am allergic to seafood, but not allergic to any medication.
Okay, Mr. John, may I ask you some personal question?
Okay, can.
Do you smoke, Mr. John?
Yes, I smoke 10 cigarettes per day for the last 30 years.
Okay, Mr. John, do you drink alcohol?
Yes, I drink one can of alcoholic beer every day.
Okay, Mr. John, is there any shortness of breath, chest
No,
pain,
no.
any increase in frequency or pain when going to the low or
When micturition is English word, Dr. Hamza.
okay.
Okay, no.
Mr. John, is there any muscle pain, joint pain?
No.
Okay, thank you, Mr. John.
All right. What's your diagnosis?
I think related to liver disease. Maybe
Maybe or it
also
is not maybe. Maybe is not good word in medicine. So what is your diagnosis is
my professional diagnosis until now hematemesis related to liver disease.
you mean varices. You mean esophageal varices. So
Varices.
this is bleeding
Okay.
esophageal varices due to liver cirrhosis. What is cause of this cirrhosis in this patient?
Liver virus from 30,
Hepatitis, past history of
hepatitis,
hepatitis and alcohol. He still drink alcohol. So this patient have liver cirrhosis, can be due to alcohol, can be due to hepatitis, of course. And as you see that hepatitis can take a long time. Of course, this is scenario is not happened nowadays because we have interferon to treat hepatitis. We have some vaccination against hepatitis B. We screen the blood product. So that usually now it is not so common. So this patient, after we treat hematemesis or make endoscope and all this, is any possibility of have a cancer in the liver?
Small percentage, I think.
No, not a small percentage. Patient with liver cirrhosis can have hepatocellular carcinoma. So this is routine in all country. You make follow up by alpha fetoprotein. Because this is cirrhosis cause chronic irritation of the liver, chronic irritation of any organ can cause cancer. Okay. So as you see here, it is the same script, the same scenario, and we can just a little change. But in the both case, you need to ask about dysphagia. So if the patient have just blood, so it is varices. If the patient have blood mixed with food, have dysphagia, difficult to swallow, to solid, and mainly in the lower part, so it is sure adenocarcinoma of lower esophagus, and usually patient have reflux for long time and they don't take a treatment or still drink alcohol, smoke, or spicy food. Okay, so whatever the script, it is important in the patient vomiting blood, you ask about dysphagia. All right, so it is easy. it is important because usually in the exam we have many script with just a little change, the diagnosis is different. So don't insist that I know that this case is cancer esophagus, can be esophagus, can be varices, can be whatever. All right, so any questions so far from anyone? Okay, so I think one of the other, either Dr. Ahmed, what is time of your exam? This month? Are you in June or
I'm in April, 26 April, it's Ireland.
Okay, good luck. Okay. So we have a 22 years girl presented in outpatient complaint of right neck swelling. Okay. So, all right. We don't mention it is a thyroid, but you ask me questions to know it is a thyroid or not. So we can start.
Okay, hello, I'm Dr. Ahmed of surgical team. May you confirm your name and age, please?
Yes, I am Anne Mary, and I am 22 years old.
Nice to see you, Miss Anne. Today I was asked to ask you a few questions regarding your condition. Is that okay with you?
Okay, can.
Would you mind taking some notes while I ask you questions?
You can take it, no problem.
Okay. Can you tell me what seems to be the problem today?
Yes, I just tried this for my wedding next month, and one of my friends, my close friend noticed I have a swelling in my neck.
First of all, congratulations for your wedding. I hope you
Okay,
get well
thank you.
soon.
Okay.
Can you tell me exactly where this wedding is?
It is in the right side of my neck, lower part.
Okay. When the first time you noticed this swelling?
Yes, it is. I don't notice. It is my friend who noticed this.
Okay. You notice that it increasing in size?
Before ask me first a question to confirm it is thyroid or not thyroid. What you need to ask?
Okay. I need to ask about toxic.
No. Doctor, just ask one question to confirm it is thyroid swelling. After that, we can ask about size shape, or you can ask about size shape, and after that, confirm it is a thyroid. Which question you can ask the patient to know it is a thyroid swelling or not a thyroid swelling? Can be lymph node, can be anything. So just ask one question. Anyone?
I think about the site midline.
No. Just ask here, is this swelling move up and down with swallowing? If yes, so it is a thyroid. If not, so you can ask about anything. So usually the key here, this swelling, yes, it is move up and down with the swallowing, and it is the right lateral side of the lower part of my right neck. So it is a thyroid swelling. Okay, after that, you ask about the site, the size, the shape, consistency, and all this. After that, ask about pressure symptom. After that, ask about toxic manifestation of the thyroid. Okay? Because if from the beginning I don't tell you it is not move up with swallowing, so can be anything, can be lymph node, can be branchial cyst, it can be carotid body tumor, whatever. Okay? So you can start again. All right, okay. Apart from name and introduction, just ask me about the swelling. Okay?
Okay. You mentioned that the swelling in your right side of your neck?
Lower part of my right side and move up and down with swallowing.
Okay, thank you. Can you tell me about characteristics of this swelling? Can you elaborate more about it, about size and shape?
Size, so just one. So the site, as I mentioned, is the lower part of my right neck, and the size is like 20 cent coin, so it is 2 by 1 centimeter.
Okay. Can you feel this swelling? What is the consistency? It feels hard or soft?
No, I think it is soft.
Okay. This swelling associated with any pain?
No pain.
Okay. Do you have difficulty in breathing?
No.
Difficulty or hoarseness of voice or any change in voice?
Change of voice or hoarseness of voice? No.
Okay.
We have 3 pressure symptoms: dyspnea, dysphagia, hoarseness voice. So no difficult to swallow, no difficult to breathing, especially at night, no change in voice. Okay. After that, when you ask about size, shape, all this, so if this is a cancer, what is the character of it?
It will be hard inconsistency and
what else?
Fix it.
Okay, attach it. So you can ask the patient, is this attached to the skin? No. Okay, so it is important to ask that. So you ask about first size, shape, consistency, attach it to the skin. After that, ask about pain, not painful. After that, ask a pressure symptom, dysphagia, dyspnea, and hoarseness voice. What else you need to ask?
Toxic symptoms.
Like what?
Like change in eye, protrusion, or any painful eye.
Any eye manifestation. Okay, what else?
Manifestation about CNS, about diet and appetite and.
No, you can ask. You can ask. We don't enumerate. You can ask.
Have you noticed any change in your appetite?
No.
Have you had unintentional weight loss recently?
No weight loss.
Okay. Do you experience any fever on a change in temperature?
Why you ask about fever?
About infective manifestation, and I will ask about.
No, even thyroiditis have no fever.
Okay.
Because you are now in the thyroid, we don't ask you in the neck swelling. If this is neck swelling, we don't decide that it is a thyroid. You can ask about fever. You can ask about other lymph nodes. You can ask about many things, because the neck have a lot of pathology. Here you need to ask about toxic manifestation, which is fine tremor or nervous irritability, increased heart rate, which is palpitation, myopathy, menstrual disturbance, gastrointestinal disturbance, eye manifestation. Okay? So you can ask again about toxic manifestation.
Okay. Have you noticed any change in appetite?
No.
Or sleep, mood disturbance?
No.
Okay. Have you noticed any skin or hair changes?
No.
Okay. Do you have any eye abnormalities, like abnormalities in vision?
Any problem in vision or eye or proptosis? No.
Okay. Do you have shaky hands or sensitivity?
You mean that you have fine tremor or tremors in the hand? No.
Okay. Do you have an intolerance to heat?
No, it is okay.
Can you feel your heartbeat or heart racing?
Can you aware by your heartbeat? No.
Okay. Any change in bowel habit?
Before that, you need to ask one. You ask about loss of weight before or not?
Ask it about it.
Okay, all right. So bowel habit is normal.
What about menstrual cycle?
It is normal.
Okay. Now I'm going to ask you: have you noticed this condition before? Have you had any swelling before?
No swelling. No.
Okay.
And no other swelling. You ask about swelling and the other swelling, like lymph node and all this. Of course, the patient not know the lymph node, just the other swelling. No.
Okay.
Okay.
Were you diagnosed with any medical condition before?
No.
You taking any regular medication?
No.
Okay. Do you have any allergy for drugs or food?
I am allergic to seafood.
Okay. Any past history of hospital admission or
no.
surgeries?
No.
Any surgery?
No.
Okay.
No.
What about social social habit? Do you smoke?
Yeah, I smoke 5 cigarettes per day for the last 3 years.
Okay. Do you drink alcohol?
Yes, occasionally in weekend.
Tell me about your diet and physical activity.
Just a normal diet, and I go to gym once per week.
Okay, some personal question, if you don't mind. What do you do for a living?
I am a student, study politics.
Okay. About residence, do you live in a city?
Yeah, I live with my family.
I think I'm asking about where do you live, near the sea or away from it?
Okay, no, it is. We don't have a sea. I live in London City, so we don't have a sea. We have a river.
Okay. About general systems, do you have any shortness of breath?
No.
Any chest pain?
No.
Okay. Any urinary symptoms like bleeding or pain or change in color?
No.
Okay, thank you. I have finished
All right.
my questions.
Why you ask about C site? Why?
How about iodine deficiency?
No, iodine deficiency, you mean that occur in the area they don't take iodine like in the past, like in Gulf area, but it is not important. Don't ask this question. We can ask you, but
Okay.
don't ask this question.
Okay.
Okay. What's your diagnosis?
My main diagnosis will be multinodular goiter or thyroid nodule toxic.
Okay, doctor, it is you ask the patient if have multiple or other swelling. She say no.
Okay.
So it
it's
is not
multi.
can be, but the patient for the history we can confirm by examination. So it is not multinodular. It is just solitary nodule in the right side. Okay, can be after investigation, can be part, can maybe this is a big nodule, the other is not palpable, but don't say something is not parallel to what you take from the history. Okay?
Yes, okay.
We don't ask you what is your differential diagnosis of the neck swelling. We ask you about this patient. So you must be more accurate. What is the investigation you do for this patient?
I will do triple assessment, physical examination, and ultrasound, and fine needle aspiration.
No, just one by one. Triple assessment, mean history, and physical examination. What is the lab investigation you need to do?
I need to do thyroid function test like TSH and T3 and 4, and inflammatory markers or antibody markers.
No, just one by one. Antibodies. Which antibody?
And in Hashimoto's anti-TBO. And
what is TBO? You mean the antithyroid or anti-thyroid globulins and all this. So you can say, I will ask for, you know, Dr. Ahmed, the way you are speaking in exam is not accepted because it is like you are enumerate. يعني enumeration. It is just start by lab investigation. Of course, the triple assessment start by lab investigation. Lab investigation, thyroid function test, T3, T4, TSH, followed by the anti-thyroid antiglobulins or thyroid antiglobulins to exclude thyroiditis or Hashimoto or whatever. What is inflammatory marker? What is the value of it?
It gives an idea about there is ongoing systemic inflammation.
Okay, so it is usually is a thyroid disease can be inflammatory.
Not usual and not significant.
Okay, so you don't say something because if you say something like that, the examiner is interested to know what you're looking for, and all these have no mark. So you waste about 1 minute, half minute. You just ask what's the inflammatory marker, what's the indication, is thyroiditis inflammatory marker is high, maybe not high, because it is not inflammation, it is more like autoimmune. You mentioned ultrasound. What is the value of neck ultrasound? For what?
To know the characters of swelling, is this soft or
cystic or solid? Okay. What else?
And no extension of the swelling.
Lymph node. So you can see the lymph node. And also, if it is cystic, what else do you need to do?
I need to do fine needle aspiration cytology.
Okay, so you do fine needle aspirated cytology. Okay, so ultrasound is very important. If we take through cut and show you this picture, this patient is 20 years and have this picture. You see the screen?
No screen is not shared yet.
Not shared. We can share it again. Okay. If you see this picture in the true cut biopsy, because this is a tissue biopsy, so what it could be?
Okay, in the left one I see papillary thyroid cancer.
Okay, both are the same. It is papillary empty nucleus or look like empty nucleus, and the other is microcalcification or samoma body. Which age papillary thyroid carcinoma appear? At which age?
I think anaplastic in old age, papillary maybe in middle age.
No, papillary age of 20, not middle age. Papillary 20. But I don't ask you about anaplastic. I ask you about papillary. So papillary at age of 20. What other cancer you know in the thyroid?
There is follicular, anaplastic, and medullary thyroid carcinoma.
Medullary thyroid. So, okay, we mentioned papillary is 20, occur at age of 20. If this patient have papillary thyroid carcinoma, the doctor advise her for total thyroidectomy for both sides, right and left.
Okay.
Although the tumor in the right side. Are you agree or disagree with this?
I agree with this, as papillary is maybe multifocal.
Not maybe, or it is multifocal.
It is multifocal.
Okay, don't say maybe. Follicular, okay, can spread by blood. Anaplastic can be local spread. This is why in history you ask about affection of the skin. Is any one of these thyroid tumor have tumor marker?
Yes, medullary thyroid carcinoma, calcitonin.
Calcitonin, okay. So which one of these cancer, apart from, you know that goiter can run in family due to lack of iodine, as you mentioned. But which cancer of these can run in family?
In a part of Men's syndrome, I think medullary thyroid carcinoma.
So Men's syndrome, which type, A, 1 or 2? Two. Medullary was 2. Okay.
2.
Okay. All right. We usually have difficult question about in the Men's syndrome. What is the oncogene called?
RET oncogene.
RET, R-E-T. Okay. This is usually, sometimes in pathology you ask you first a question just to give you some shock. It is difficult. Even the examiner don't know this RET. RET, R-E-T, like red but by T. Okay. In the medullary thyroid carcinoma, you mentioned what else can occur in multiple endocrine neoplasm type 2?
In multiple endocrine neoplasm type 2, I have papillary thyroid cancer and medullary thyroid carcinoma and a pheochromocytoma.
What is pheochromocytoma arise from?
Arise from suprarenal medulla.
What is that? What is the suprarenal medulla secrete?
Catecholamines.
Okay, what is it? Is appear in urine. What we called it?
VMA, vinyl mandelic acid.
Okay, all right. So it is important just to ask. It is easy question, but by the way, Men's syndrome is just medullary, not papillary, pheochromocytoma, and the parathyroid adenoma. Okay, if you ask in embryology, because nowadays medullary thyroid carcinoma or calcitonin secreted is now considered as endoderm, because in the past we expected that is ectoderm, but now they prove it is endoderm. Maybe the last 2 years they prove that it is endoderm. The examiner not ask you this. Okay. Dr. Ahmed, it is important in exam, don't enumerate like writing a book. So like when ask the investigation, I do triple assessment, I do lab investigation, tumor marker. So you must justify. Justify mean if you mention tumor marker, why I mention tumor marker. If you mention thyroid antibodies, just to exclude Hashimoto or thyroiditis or something like that. And of course, if it is tender, it is thyroiditis. Okay, or Hashimoto. By the way, the last question to you is we don't mention lymphoma, and it is correct. So when lymphoma can occur in thyroid gland?
In Hashimoto thyroiditis.
In Hashimoto thyroid. This is why we don't consider non-Hodgkin lymphoma is a thyroid tumor, because it is arise in the top of Hashimoto. Okay? Thank you, Dr. Ahmed. Good luck in exam. Any comment?
Thank you. In this part of enumeration, I think يعني وقت الامتحان هيسمح في 3 دقايق ان انا اتكلم واقول بالتفاصيل ولا just
طبعا
enumerate what?
لا انت ما فيش enumerate, انت just must justify. يعني for example if it is a case of acute appendicitis I will ask for full blood count looking for leukocytosis. ما هو يعني هو انت what is called social intelligence in exam or management of time. You don't ask something is not related to the history and waste time into taking a history and ask the patient some silly question and something is not related. Okay.
Okay.
By the way, for example, because you and your friend ask about where you live and you live with whom, this is not important at all, except in some cases like orthopedic or cases like patient have a stroke or something. You need to know for whom we live. Maybe alone, maybe something. But patient have a thyroid and 20 years old. It is not important to know. It is not important to know from what she do for living. He can ask. You can ask, no problem. All right.
Okay.
The last scenario is interested. It is come, I think, yesterday also. Is the irritable patient, or what we called it, anxious patient. So we have Dr. Muhammad Ali. What time of your exam, Dr. Muhammad? You are here or in work? Dr. Muhammad Ali. You hear us or not? You are muted. Okay. If it's okay, we can ask Dr. Hamza again. All right. Although Ahmed, you come in Ahmed Fathi, you are enter the exam because I will ask you this question because this is maybe common exam. You see the screen now. You see the screen.
No, it is not shared.
Okay. All right. I just share with you. Okay. Because this station is coming yesterday, I think, in the exam, so we just here diagnose with you. It is a 50-year-old woman diagnosed as chronic cholecystitis in the pre-operative assessment clinic. She had a history of intermittent episode of breathlessness for 10 years. Take a history from the patient. Before you start, if you see this scenario, you expected this patient have serious condition or not? Apart from gallbladder, now is simple operation can done by laparoscope.
No urgent.
No, apart from urgent, this is just a problem. Is something serious or not?
No, it's a chronic.
Why? It's chronic for 10 years. So, okay. So before also we start, what you expected, the condition in chest stay for 10 years, patient is okay. So what it could be?
Bronchial asthma.
Bronchial asthma. Okay, so you know from the beginning, after you read the instruction outside, you know this patient have some long history of chest problem. This is can be infection, not be infection, but it is not serious. With you can start. So you can start.
Okay, hello, I'm Dr. Ahmed, I'm surgical team. May I confirm your name and age, please?
Yeah, I am Anne Mary. I am 50 years old.
Nice to meet you, Miss Anne. Today I was asked to ask you a few questions regarding your condition. Is that okay with you?
Yes, can.
So can you tell me what seems to be the problem today?
No, I just came to be admitted for laparoscopic cholecystectomy. And they tell me you need to go to the pre-admission clinic. Is this pre-admission clinic?
Yes, it's a pre-admission clinic, and I have
Okay.
to ask a few questions regarding your past medical history and
Okay.
any questions. Okay. Can you tell me, are you diagnosed with any chronic condition?
Yeah, I have a long history of shorting of breath.
Okay. Any other medical condition?
No, doctor, if the patient say I have a problem, you need to analyze it. So I have shorting of breath, I have difficulty breathing, something like that. Okay. It is for the last 10 years, long time.
This certainty of breath is increasing now, or it is the same?
No, it is on and off.
Okay. Do you take any medication for this condition?
I take inhaler. I use it at the time, and usually this is come to me in the spring time, in March.
Okay.
Doctor, you see the screen.
Oh, okay.
Okay, so I tell you what is the question can be like. You ask about how long, so it is 10 years. Is the attack, how long it take? About 10 minutes? Oh, occur once per week or once per month? Are you sleep well? Any nocturnal dyspnea? So you ask about something related to the heart, like you know that in the heart conditions they have dyspnea and dorsopnea. After that, you ask about is this attack related or increasing with diagnosis of gallstone? Yes. What is the attack? Shortening of breath, unable to talk, tight chest, I breathe rapidly, shallow breath. You have numbness at this time? Yes. Sometimes. Any chest pain? No. Just to exclude ischemic heart and all this. If the pain is radiated to left arm? No. Is this pain like biliary colic? No. Any epigastric pain? No. Any difficult to swallow? No. After that, you ask about fever to exclude chest infection, wheezy chest, cough of blood, and you confirm that it is between attack is normal. After that, you ask about anything in the history. Okay? You got the idea. Because here, I tell you what is the pre-admission clinic mean. Pre-admission clinic or pre-operative assessment is a clinic usually run by a houseman or by anesthesia, just to take a history from a patient and prepare something unexpected, not related to surgery. Okay, it is like in your hospital they have like عرض التخدير أو anesthesia looking to the patient before surgery to know something maybe not recognized by surgeon, because the surgeon just to concentrate this is gallbladder need to remove, and the patient with bronchial asthma between the attack is totally normal. Okay, so this is the idea of this pre-admission clinic or pre-operative assessment clinic. Okay, usually run by young doctor, and usually it is combination between houseman in surgery, anesthesia, or sometimes only anesthesia. So, and Mary, the only problem is shorting of breath. So you can start to ask. I put the question in the screen just to remember. Okay?
Okay. I'll ask you about this condition. When was your last attack of
it is this condition is for 10 years, and the last attack is 1 week ago.
Okay, let's elaborate more about these attacks. How long does it take?
It is 10 minutes, maximum 20 minutes.
Okay. How often this attack
it is once per week, sometimes once a month, but increase usually at the springtime.
Okay. Do you have any associated chest pain?
No chest pain.
No. Do you sleep when you sleep flat? Do you have a problem with this?
No, we just ask to exclude cardiac conditions. So ask about dyspnea or orthopnea or nocturnal dyspnea. No.
Yeah. Okay. Can you describe the attack?
It is like tightening of my chest and unable to talk, some wheezes, shallow breath. So it's very difficult. After that, during this time, you need to ask here what you do. Ask me.
What you do during this time?
Yes, the doctor described me spray. I use this spray. It is a relax or bronchodilator. I use it at the time of the attack.
Okay, after the attack, can you tell me what you do or how you feel?
No, I become totally normal.
Okay. You mentioned that you don't have any associated chest pain?
No chest pain.
Okay. So I can't ask about any pain anywhere else other than chest?
No, but you need to still in chest, you ask about fever or chest infection or cough or coughing blood. So the idea of this station, first, it is a history. So we take all item of history, but we start by this patient have something from beginning. We look like bronchial asthma, nothing serious. But what you ask about how long stay. You need to exclude it is not related to the heart, like dyspnea or orthopnea. You need to exclude it is not chest pain. You need to exclude it is not chronic bronchitis, so the patient have no fever and no secretions. After that, you can ask other part of history.
Okay.
So you can ask.
Do you have any chronic medical condition? Have you diagnosed
like what?
It? Like hypertension, diabetes?
Hypertension, diabetes, dyslipidemia, no.
Do you take any regular medication other than
Yes, the doctor, after I become 40, he asked me to take oral anticoagulant like baby aspirin and say it is routine, but I don't have any problem. He just say because of the old age.
Okay. Do you have any drug allergy or food allergy?
I am allergic to seafood.
Okay. Does anyone in your family have this condition?
No, but my mother died from cancer colon.
I'm so sorry about that.
Okay.
About social habit, do you smoke?
Yes, I smoke 5 cigarettes per day for the last 20 years. The doctor asked me many times to stop smoking, but I say 5 cigarettes is not much amount.
Okay. Do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day for the last 10 years.
Okay. Can you tell me about your diet and physical activity?
Yeah, I usually take fast food and I go to gym once per week.
Okay. Some personal question, if you don't mind. What do you do for a living?
I am retired teacher.
Okay. Who lives with you?
Is my husband.
Okay. Okay. Thank you. I
You
finished
don't
my call.
ask about other system.
Oh.
So other
Okay.
system like urinary, of course, you ask about chest, like diarrhea, constipation, loss of weight, all this. Okay, what is the investigation you will ask for this patient?
I asked for respiratory function tests and
Doctor, relax. You don't jump. First,
Okay.
you ask about baseline investigation, lab investigation, full blood count,
Mm. Full
urea,
blood count.
electrolyte, sugar, chest X-ray, respiratory function test. You mentioned respiratory function test. Okay. What you expect is the next question from examiner.
Show me the curve.
Okay, so it is important to put in your mind, of course, you draw the curve, just a simple way like this. Tidal volume, inspiratory, expiratory volume, and measured by respirometer. So this is like respiratory function test. Okay. After that, you can ask for, of course, chest X-ray. This is the chest X-ray. What you see in this chest X-ray?
I see right tension pneumothorax.
Right tension pneumothorax, okay? Of course, sometimes in exam, for exam purpose, we show you something not related, but usually we try to be related. So in this station, if you show the chest X-ray, 100% it is normal because the patient of bronchial asthma, if you make chest X-ray, it is normal, but I just make it for teaching. You mentioned baseline investigation, chest X-ray, respiratory function test, arterial blood gases. In some cases, we can ask for CT. All right, so just tell me, doctor, how to take arterial blood gases.
Okay, we take it by heparinized syringe and
Yes.
send it for the machine, and I keep compression on the artery about 5 minutes the bleeding time.
Okay, more than bleeding time. Okay. So in this case, this patient, shall we do the cholecystectomy for her or not?
We can do it, but after consultation with anesthesia team.
ما هو
And also,
okay, after anesthesia, chest, but he have no problem now, so can do it. Anesthesia is no have no problems. Can we do it?
can do it without general anesthesia if it is
The
possible.
doctor, relax. Don't,
Okay.
you know that if you have a lot of knowledge, it is easy to fail. I think you are looking for this patient have chest problem, so it is better do regional anesthesia. By the way, it is impossible to do laparoscopic surgery with regional anesthesia because the air is come, this is carbon dioxide come till the diaphragm.
That's right.
So we don't have laparoscopic cholecystectomy by regional anesthesia. We not mention now. If you do it, so become the first case laparoscopic cholecystectomy by regional. Okay? So don't be so clever. This is laparoscopic cholecystectomy, must done a general anesthesia. This patient have bronchial asthma, just to avoid to be in panic or stress, because sometimes the stress and the pain can cause precipitation of the asthma. Okay, so what's your diagnosis in this patient?
Bronchial asthma, chronic bronchial asthma.
Okay, so just an anxiety, the patient afraid, can be bronchial asthma. Maximum, if the patient mentioned fever, can be asthmatic bronchitis. So it is easy. This station is very common. Easy station also, and simple. Okay.
Okay.
The last one I asked doctor again, who started Dr. Hamza, it is about headache. Okay, so again, as you see, the history taken
Okay.
is easy. But if you ask many students, maybe for yesterday, they don't reach the level they ask about the respiratory function test because they waste their time for asking something in the history is not important. Not important if the patient have bronchial asthma, you ask here where with whom you live and which floor and all this. Okay, so Dr. Hamza, I hope that you see
Okay.
this one. Okay. So this
Okay.
is a case of headache. Headache can be many things, but just a headache. 25 years
Okay.
old man, suddenly have severe headache, coma 10 days ago, now improved by treatment. So take a history.
Okay. Good morning.
Okay, good morning.
I'm Dr. Hamza, one of the surgical doctor. May I confirm your name and age, please?
Yeah, I am John. I am 20, what's called 25 years old.
Okay, nice to meet you, Mr. John. Today I have been to ask you a few questions regarding your condition. Is that okay
Yes.
with you, Mr. John?
Yes.
How can I help you today, Mr. John?
No, you can ask me. I have severe headache. I went to the coma. Now I am okay.
Okay. Do you need a painkiller?
No need.
Okay, Mr. John, where exactly the site of pain in your head?
It is in the back of my head and severe pain. It is 10 days ago. After that, I was in coma.
Okay. Could you please describe the pain for me?
It is like severe headache, and after that, I forget what happened. I wake up, they say I was in coma 10 days.
Okay, really sorry to hear this, Mr. John. Mr. John, do you have recent trauma?
No
to
trauma.
your head?
No trauma.
Okay. Okay. Mr. John,
Doctor, usually in analyzing of headache or pain, you can ask about radiation of pain. It is not radiated, associating symptoms like nausea and vomiting. Okay.
Okay. Okay. Is this pain, Mr. John, radiated to anywhere else in your body?
No.
Okay, Mr. John, is the pain all the time or comes and goes?
No, it is intermittent and come 2-3 times. After that, I went to the coma.
Okay, Mr. John, is the pain related to specific time in the day? I mean,
no, it is
at the
occurring
morning.
evening. After that, I was in coma.
Okay, Mr. John, could you please describe the pain for me on a scale from 1 to 10,
No,
which 10 being worst
it is
pain?
severe pain. It is about 9.
Okay, Mr. John, how does this pain affect your life in general?
No, I was in coma.
Okay.
I become in coma.
Okay, sorry. Mr. John, is the pain associated with vomiting?
Yes, I
anything?
have nausea and start vomiting, and the doctor say it means that the pain is severe.
Okay, Mr. John, is there any fever?
No fever.
Any weight loss recently?
No weight loss.
Okay.
You ask about fever, you ask about trauma. Okay. What else?
Okay. Mr. John, is there any medical problems?
Before you ask about medical problem, you need to ask about, of course, you go to the headache. So you ask about trauma. If any head trauma, you ask about fever, toxoplasmosis, meningitis. Suppose this patient have mild meningitis, so it is affect visual. Sometimes the patient of the meningitis have some visual disturbance. So you can ask about this. You can ask about loss of sensation. You can ask about, of course, they have loss of conscious. You can ask about any paralysis or paresis after the neck stiffness. So it is in blackout. All this, it is important to exclude meningitis and trauma. After that, you ask about other part of history. Okay. So I just repeated just for, so you ask about the site, the onset, any warning sign, it is intermittent or continuous, describe the pain, radiation of the pain, nausea, vomiting. You ask about fever for meningitis, you ask about trauma, you ask about any weakness or sensory loss or hemiplegia or hemiparalysis or paraplegia, any relieving factor if have, how long it's stay. It is important to ask about visual disturbance, sensory disturbance. Of course, they have loss of conscious, you know that. Any neck stiffness, because neck stiffness usually with meningitis, and any like convulsion or epileptic attack and others. After that, you complete the history in normal way, like other system, past history, social history, all this. Okay, so we can review it again. So I am Mr. John. I am 25 years old. Go on.
Okay. How can I help you today, Mr. John?
Actually, I have a bad experience. I have severe headache followed by coma for 10 days. After that, now I am
sorry
okay.
to hear this, Mr. John. Do you want to take a painkiller?
No. Thank you.
Okay, Mr. John, could you please give me the site of the pain exactly?
No, it is okay. I have severe headache in my back of the head, and it is okay twice. Okay, you can ask.
When exactly do you feel this pain?
It is 10 days ago. I have this pain twice.
Okay, Mr. John, could you please describe the pain for me?
It is severe headache.
Okay, Mr. John, is the pain radiating to anywhere else in your body?
No.
Okay, Mr. John, do you have a trauma?
Yeah, no head injury at all.
Okay, Mr. John, is the pain increasing with anything?
When I move my head, the pain is increasing, but after that I was in coma, so I don't recognize anything.
Okay, anything relieving the pain, Mr. John?
Because at this time I try many painkillers, is not relieve it.
Okay, Mr. John, is there any neck stiffness?
No.
Any fever?
No fever.
Okay, any sensitivity to the light, Mr. John?
No.
Okay, Mr. John, is there any visual disturbance?
No.
Okay, Mr. John, is there, do you feel or there is any raccoon eyes, some blood
No,
around,
don't ask this question. Raccoon eye in trauma, it's difficult to ask the patient about this. Is this physical examination? And the patient say it not trauma is not trauma. Don't waste the time for extra question. You exclude fever, meningitis, you exclude trauma. So we just ask, you just need to exclude other if this patient have hemiparesis or hemiplegia or any paralysis. No. Okay.
Okay.
After that,
Mr.
Yes,
John, is there any associated features like vomiting, nausea?
Yeah, I have nausea when the pain is severe. After that, I went to the coma, so I don't know what happened to me.
Mr. John, is there any sensory loss in your body? Do you feel recently?
You mean the weak sensation in my arm or leg? No.
Okay.
Movement also is okay. All right.
Okay, Mr. John, is there any episode of loss of consciousness recently?
Yeah, I lost of conscious. I was in coma 10 days ago. I just recovered today.
Okay, Mr. John, is there any fits or seizures?
No.
Okay, Mr. John, any other medical problems do you have, like hypertension, diabetes?
No, I am so young. I am 20. 25. So I don't have hypertension, diabetes.
Okay. Do you have any surgical operation, Mr. John?
No.
Okay. Mr. John, do you take any drugs?
No medication at all.
Okay. Do you have any allergy against drugs or food?
No.
Mr. John, is anyone in your family had similar problem?
No, but I think my grandfather died from a heart attack.
Really sorry to hear this, Mr. John.
Yeah.
Mr. John, may I ask you some personal question?
Can.
Okay. Mr. John, do you drink alcohol?
No, I don't drink alcohol. I just smoke 5 cigarettes per day.
Okay. Mr. John, any weight loss?
No weight loss.
Or any change of your appetite, Mr. John?
No.
Okay. Mr. John, do you aware of your heartbeats?
No.
Okay. Mr. John, any color change of the urine or increased frequency?
No, urine is okay.
Okay. Thanks, Mr. John. I will discuss.
All right. Thank you. What's the investigation we need to do for this patient?
In the lab investigations, general lab investigations like full blood count, urea, electrolyte, liver function test.
What else you need to do apart from lab investigation? This is all are normal. What else?
Electrolytes like glucose.
Okay. What else? Radiological investigation.
Radiological CT.
Okay, we did CT for you, and you can see the picture. You see the picture.
Okay. I think intraventricular hemorrhage.
What is the cause? Whatever the okay can be. What is the cause? This patient is 25. What is cause of this hemorrhage? What it could be?
I think aneurysm. Or...
You mean perianeurysm? So if you have perianeurysm, so it is subarachnoid hemorrhage, not intraventricular. Okay. So this is subarachnoid hemorrhage. Usually AV malformation or perianeurysm. Okay. So of course this patient is lucky he's okay. So but actually we did a management. So no, what you expected management we did for him in England, maybe not in your country.
Okay. Firstly, I will manage the patient after discussion with. Firstly, I will manage the patient according to CRISP protocol, including ABCD approach. After assessment of the patient and give him fluids and also give to the patient nimodipine.
What is nimodipine?
Calcium channel blockers.
Okay, calcium channel blocker. Okay, so you aim to decrease the pressure in this. Okay, calcium channel blocker. You refer to neurosurgery. You give intravenous fluid, but the patient now is okay. So what maneuver we need to do or done to him?
Bear hole and craniotomy to decompress the hemorrhage.
Doctor, it is difficult to reach perianeurysm by craniotomy because if you remember, it is in the base of very difficult to go to from here to go to the perianeurysm. But we went to there. But what is the route we use it to go to close this bleeding?
I think bear hole.
Okay, you can see the screen now.
Yeah, I see.
You see, so don't say bear hole or craniotomy. What is done in England? They have embolization, like something like coil, like some material. So to force the aneurysm made. So this is the way to relieve the patient. Okay.
Okay.
So you know that sometimes it happened. Maybe remember that sometimes if happened the patient have aneurysm, or discover accidental. They have AV malformation or perianeurysm. In some country, in European countries, they do embolization before the patient have presentation. But in our country, this patient usually presented at age of 40 due to hypertension and cause rupture of one of these perianeurysm, and the patient have subarachnoid hemorrhage and maybe die from subarachnoid hemorrhage. In European country, if diagnosed accidental or presented, they do coiling. Coiling means they put some foreign material or some irritating material to the main blood vessel for perianeurysm. Of course, you remember the anatomy. It is from the two vertebral artery become basilar and the branches from the internal carotid. And they know what is the source of bleeding and make control of it. Okay. Actually, not practical and not logic to do craniotomy, because if you remember the skull, it is in the base of the skull. All right, so you can give dehydrated measure, you can give calcium channel blocker, you can give
also diazepam,
sedation, all this, but the aim is just to relieve the tension and stop bleeding. Okay. Of course, if this patient is old patient and take aspirin or something, you need to stop that. Maybe the cause, but usually it is AV malformation, and this is easy stage. Okay. This is the common, I think is the common question I need to tell you. Okay. First to comment about Dr.